Welcome back, everyone, to The Deep Dive. You know, we love to explore all sorts of fascinating topics in healthcare, and today we're diving into something you might not expect.
Definitely a bit off the beaten path.
We're talking tranexamic acid, or TXA in dentistry.
That's right. TXA, it's making waves in the dental world, and we're here to break it all down for you.
Now, you've probably heard of TXA as a medication,
Yeah, maybe in connection with heavy menstrual bleeding.
right? But what you might not know is how much it's being used in dentistry these days.
And for good reason. It's
Yeah.
proving to be a real game changer in terms of controlling bleeding and improving patient outcomes.
So let's start with the basics. What exactly is TXA, and how does it work its magic in the dental office?
Well, TXA is an antifibrinolytic medication, which might sound complicated,
Yeah, a little bit.
but it basically means it helps control bleeding by preventing clots from breaking down.
Okay, so it doesn't actually form new clots, it just makes sure the existing ones stay put.
Exactly. Think of it like this. You've got a wall made of bricks and mortar. The bricks are the clotting factors in your blood, and the mortar is like fibrin, which helps hold those clots together.
So TXA is kind of like reinforcing the mortar, making those clots extra strong.
That's a great analogy. And that's why it's so effective in dentistry, where bleeding control is so important.
So let's talk about how this plays out in real-life dental scenarios.
Absolutely.
One of TXA's FDA-approved uses is for patients with hemophilia who are at high risk for excessive bleeding.
Right. For them, even something as routine as a tooth extraction can be a major concern.
So how does TXA help in those situations?
Well, TXA can significantly reduce bleeding during and after dental procedures.
Making them much safer for these patients.
Exactly. I've heard from dentists who used to have to hospitalize hemophilia patients for simple extractions because the bleeding risk was so high.
Wow.
Now, with TXA, they can perform those same procedures in their office with minimal complications.
That's incredible. It's giving these patients a level of care they might not have had access to before.
Absolutely. And it's not just about safety, it's also about improving their quality of life. They don't have to worry as much about spontaneous bleeding or prolonged recovery times.
It sounds like TXA is really giving them a sense of normalcy they might not have had before.
Exactly. And that's one of the most rewarding things about using TXA. It can really make a difference in people's lives.
But TXA isn't just for people with bleeding disorders, is it? I've heard it's becoming increasingly popular in other areas of dentistry as well.
Absolutely. And that's where things get really interesting. Dentists are now using TXA for all sorts of procedures, from routine cleanings to complex implant surgeries.
Wow, so it's really becoming a go-to tool for dentists across the board.
It is, and one area where it's making a big impact is in controlling postoperative bleeding and bruising.
That makes sense. I mean, who wants to deal with a swollen face and discomfort after a dental procedure?
Exactly. With TXA, patients can experience a much smoother and more comfortable recovery.
So less pain, less swelling, faster healing. Sounds like a win-win for everyone.
Absolutely, and it's not just about aesthetics either. Reduced bleeding means a clearer surgical field for the dentist, which can lead to greater precision and efficiency.
Oh, I see. So it benefits both the patient and the dentist in multiple ways.
Precisely. It's a real game changer for everyone involved.
Now, I'm curious about how TXA is actually administered in a dental setting. Are we talking pills, injections, something else entirely?
That's another great thing about TXA. It's very versatile. Dentists have several options depending on the situation.
Like what?
While they can prescribe oral pills for patients to take before or after surgery,
Okay, that makes sense.
there's also a topical solution that can be used to irrigate the surgical site or applied to packing materials.
Interesting. So they can really target the medication to where it's needed most.
Exactly. And for even more localized control, they can inject TXA directly into the area, either mixed with the local anesthetic or as part of a tumescent solution.
Hold on, tumescent solution. What's that?
It's basically a solution that causes swelling and firmness in the tissues. It's often used in cosmetic surgery, but dentists are finding it helpful in certain procedures as well.
Like what kind of procedures?
Well, for example, it can be used to provide better access to the surgical site or to create a more controlled environment for wound healing.
Oh, I see. So by adding TXA to the tumescent solution, they can further enhance bleeding control in those specific areas.
Exactly. It's like a 1-2 punch for managing bleeding.
Fascinating. So we've got pills, topical solutions, injections. It really does seem like TXA can be tailored to different needs and procedures.
It can, and that's what makes it such a powerful tool in the dental arsenal.
Now, with all these different administration methods, I imagine the dosage must vary quite a bit too.
You're absolutely right. The dosage depends on a number of factors, including the patient's weight, medical history, the type of procedure, and the route of administration.
It sounds like it's not a one-size-fits-all approach.
It's not. It's all about finding the right dose for each individual patient to ensure both safety and effectiveness.
So it really comes down to the dentist's expertise and judgment.
It does, and that's why it's so important to have a thorough conversation with your dentist about your specific needs and concerns.
They can help you determine the best course of treatment for your individual situation.
Exactly. It's all about personalized care.
Okay, so we've talked about what TXA is, how it works, and the different ways it can be administered.
We've covered a lot of ground.
But of course, with any medication, we have to talk about safety.
Of course.
Is TXA safe for most people? What are the potential side effects?
Overall, TXA has a very good safety profile, especially when used in the doses typically prescribed for dental procedures.
That's reassuring to hear.
And there have been large-scale studies looking at TXA safety.
Oh, really?
Yes. One of the biggest ones was published in the New England Journal of Medicine, and it found no significant difference in clotting risks between people who received TXA and those who received a placebo.
Wow, that's pretty compelling evidence.
It is. But as with any medication, there are some potential side effects that people should be aware of.
Like what?
Well, the most common ones are usually mild and temporary things like nausea, vomiting, or diarrhea.
Okay, those don't sound too bad.
They usually go away on their own and rarely require any treatment.
But what about more serious side effects?
There are some rarer but more serious side effects like seizures, but those are incredibly uncommon, especially in dentistry where the doses are much lower.
So it sounds like the benefits generally outweigh the risks, especially when we're talking about procedures that could otherwise involve a lot of bleeding.
I think that's a fair assessment.
But are there any situations where TXA might not be recommended?
There are a few contraindications to be aware of. For instance, we need more research on TXA's effects during pregnancy, so it's best to err on the side of caution there.
That makes sense.
Also, if you have a history of blood clots or certain medical conditions, your dentist will want to evaluate your situation carefully to determine if TXA is right for you.
It's all about personalized care and making sure the benefits outweigh any potential risks. And what about people with kidney issues? I know they often have to be careful with medications.
That's a good point. For patients with kidney problems, the dosage of TXA may need to be adjusted to ensure it's processed safely.
So again, it comes down to that individualized approach.
It does. Every patient is unique, and their treatment plan should reflect that.
All right, so we've covered a lot of ground here in part one. We've talked about what TXA is, how it works, its benefits for patients with bleeding disorders, and its growing popularity in various dental procedures.
We've also discussed different administration methods, dosage considerations, safety, and potential contraindications.
We've really given our listeners a comprehensive overview.
I think so. And hopefully we've sparked some curiosity about this amazing medication and how it's changing the face of dentistry. You know, it's fascinating when you think about it,
What's that?
that a medication originally used to control heavy menstrual bleeding
Oh, right.
is now helping people heal faster after dental surgery.
It really is amazing how medical knowledge kind of crosses over like that. You never know where the next big breakthrough is going to come from.
Absolutely. And speaking of breakthroughs, we've talked about TXA's use in surgical extractions and implant placements,
Right.
but its applications go even further. Some dentists are using it to manage bleeding in patients undergoing biopsies or even routine cleanings.
Even for routine cleanings, I wouldn't have thought that would be necessary.
Yeah, it might seem surprising, but for certain patients, even a routine cleaning can pose a bleeding risk,
Okay, I guess that makes sense.
especially for individuals with bleeding disorders, those taking blood thinners, or even just those with sensitive gums.
Right.
TXA can provide that extra layer of safety and predictability.
So it's not just about the quantity of bleeding then, but also about making those procedures more manageable
Exactly. For both the dentist and the patient.
and less stressful for everyone involved, I'm sure.
Absolutely. And it's not just about stopping the bleeding either.
Oh, what else?
TXA can also have a positive impact on the quality of healing.
Interesting. How so?
Well, some studies suggest that it may promote faster wound closure and reduce the formation of scar tissue.
So it's not just about putting on the brakes. It's about steering the healing process in a positive direction.
That's a great way to put it. And this is where things get really exciting.
Oh, how so?
As research on TXA continues to evolve, we're likely to uncover even more applications and benefits within dentistry.
Like what?
Well, one area that's generating a lot of buzz right now is regenerative dentistry.
Regenerative dentistry. That sounds pretty futuristic. What exactly does that involve?
It's all about harnessing the body's own healing power to repair or replace damaged tissues.
Wow. So instead of just patching things up, we're talking about actually regenerating lost tissues.
Exactly. It's a fascinating field that holds immense potential for restoring oral health.
And how does TXA fit into all of this?
Well, research suggests that TXA may actually enhance the survival and function of stem cells.
Stem cells, those are the building blocks of tissue regeneration, right?
Precisely. And TXA might create a more favorable environment for those stem cells to thrive.
So it's like giving them a boost.
Exactly. By reducing inflammation and stabilizing the surrounding tissues, TXA might allow those stem cells to do their job more effectively.
So are there specific procedures where TXA is showing promise in this area?
Absolutely. One area is bone grafting, which is often needed before dental implants can be placed.
Okay.
TXA seems to enhance bone formation and integration of the graft, leading to better outcomes for patients.
That's great.
Another promising area is gum regeneration, where TXA might help stimulate the growth of new gum tissue.
So not only does it help control bleeding, it could also help regenerate tissues. That's pretty incredible.
It really is.
Yeah.
And as research continues, we're likely to see even more applications for TXA in the future.
So from preventing bleeding to promoting healing and even potentially regenerating tissues, it sounds like TXA is revolutionizing the way we think about dental care.
I think that's a fair assessment.
Mm.
And as research continues, we're only going to learn more and more about its potential.
Well, this has been incredibly insightful. I'm already thinking differently about my own dental care,
I'm glad to hear that.
but I'm sure our listeners have lots of questions as well. Should we shift gears and tackle some of those common queries?
Let's do it. I'm happy to share what I know.
All right, so we've spent the last two parts really digging deep into the world of tranexamic acid in dentistry.
A fascinating world it is.
And I think we've made it pretty clear why TXA is creating such a buzz.
Definitely a game changer.
But I'm sure our listeners still have some questions.
Oh, I'm sure they do.
So let's jump right in and tackle some of those common queries.
Sounds good.
Okay, first things first, safety. Is TXA safe for everyone?
Well, that's the million-dollar question, isn't it? And the answer is, like most things in medicine, it depends.
Okay, fair enough.
Overall, TXA has a very good safety profile, especially when used in the doses typically prescribed for dental procedures.
That's reassuring to hear.
But it's important to remember that every medication has potential side effects, and TXA is no exception.
So what are some of the most common side effects people might experience?
Well, the most frequently reported ones are usually pretty mild, and they tend to be temporary. Things like nausea, vomiting, or diarrhea.
Okay, nothing too scary.
No, usually not. And they typically go away on their own without any treatment.
But what about those more serious side effects we talked about earlier, like seizures?
Right. Those are incredibly rare, especially in dentistry where the doses are much lower.
But it's still something to be aware of.
Absolutely. It's important to have an open and honest conversation with your dentist about your medical history and any concerns you might have.
They can help you weigh the potential benefits and risks and make sure TXA is the right choice for you.
Exactly. It's all about that personalized approach to care.
Now, speaking of risks, are there any situations where TXA is definitely not recommended?
There are a few situations where TXA should be used with caution or avoided altogether.
Like what?
For example, pregnant women need to be extra careful because there's not a lot of research on how TXA might affect the developing fetus.
So it's best to err on the side of caution there.
Absolutely. And people with a history of blood clots, certain types of anemia, or a history of stroke also need to talk to their dentist before using TXA.
Because those conditions could potentially increase the risk of complications.
Exactly. It's all about managing those risks and making sure the benefits outweigh any potential downsides.
Now, what about cost? Is TXA an expensive medication?
That's a good question, and one that I know a lot of people are concerned about.
Yeah, especially these days.
But the good news is that TXA is available in generic form, which makes it much more affordable than many other medications.
That's great news.
So while the exact cost will vary depending on your insurance and other factors, it's generally a pretty accessible medication.
Well, that's definitely a plus.
It is. It's a really valuable tool that's becoming increasingly available to more and more people.
So if someone's listening to this and thinking, hey, this TSA stuff sounds pretty amazing. I wonder if it could benefit me. What should they do?
The best thing to do is talk to your dentist.
They can answer any questions you might have.
Exactly. They can assess your individual needs, discuss the potential benefits and risks, and help you decide if TXA is right for you.
So it all comes back to that open communication between the patient and the dentist.
It does. It's the foundation of good dental care.
Well, I think we've covered just about everything there is to know about TXA in dentistry.
We've given our listeners a lot to think about.
From controlling bleeding to promoting healing and even potentially regenerating tissues.
And it's clear that TXA is transforming the way we approach dental care.
Absolutely. It's an
Wow.
exciting time to be in dentistry.
It really is. And it's great to see these kinds of advancements that are improving patient outcomes and making dental procedures safer and more comfortable.
On that note, I think it's time to wrap up our deep dive into tranexamic acid.
Thanks for having me. It's been a pleasure.
It's been great having you. We've learned so much.
And we hope our listeners have too.
So until next time, keep exploring, keep learning, and keep diving deep into the world around you.